Hi, I'm Dave Gardy here from AVA TV Studios near Washington, D.C. for this special presentation feature around the 29th Annual AVA Scientific Meeting. And with us via WebEx right now, coming to us from New York, is Eddie Korycka, who's the Clinical Education Director for Centurion. Thank you for joining us, Eddie.
Thanks, Dave. I appreciate you giving us the spot.
Now, what is one of your primary product offerings for the vascular access market that Centurion offers?
Well, Dave, we started out as Tri-State Hospitals Supply, providing commodities to hospitals. But then Centurion has always sought to partner with clinicians and improve outcomes. So over time, we developed the SorbaView line of dressings. And then from there, we received feedback from clinicians and evolved that line into what is now our SorbaView Shield line, which is a securement dressing.
Now, what does the SorbaView Shield offer?
It solves a two-part problem. On one hand, you need site protection that covers the site and keeps it from getting infected. And on the other hand, you need the ability to secure the catheter and keep it from either migrating in and out, which would cause phlebitis, or coming out altogether, which would be a disastrous loss of the line.
How does the SorbaView Shield affect patient outcomes?
Well, the first thing it does is it makes it easy for all nurses. Vascular access nurses are particularly dexterous because of their experience with placing catheters and changing dressings. But when you spread out to, the different areas of the hospital and floors, the focus isn't necessarily on central line care and maintenance. It's on other specialty interventions. And so the dressing is intuitive. It's easy to use, it's easy to put on, and easy to take off. It does two things in one, so it'll cover multiple devices in doing so. So one dressing could potentially cover at least 3 or 4 central venous catheters. We have a peripheral dressing that covers both peripheral IVs and arterial lines. And, of course, the durable cover that lasts for up to 7 days reduces the potential for infection.
Now, does Centurion offer only dressings?
No. Actually, Centurion has a very large product line, but of particular note to vascular access specialists, we offer a custom-built central line bundle kit. That has everything your team needs in it in the desired sequence to prevent infection and improve outcomes, and offer the best patient care possible during and after central line insertion. At a time when it's more vital than ever for hospitals to focus on reducing infection risk, Centurion's zone defense, which is our approach, can be a powerful way of achieving compliance and cost savings. We recently introduced a CVC stock bundle kit, which is a unique concept in central line insertion trays. It covers all of the 1A items that the CDC recommends in reducing complications and infection. And it breaks things down into 3 distinct zones: the maximum barrier zone, the catheter insertion zone, and the site protection zone. Within each of these zones, the CVC stock and bundle tray can be adjusted to meet the precise needs of a particular hospital. We can add a specific checklist for a hospital. We can add their particular valves and dressings. And it also offers sterile field-ready saline syringes in the tray. And we can mix the tray with the customer's choice of 12 different catheters, making it the most flexible CVC insertion stock tray in the industry.
Now, what unique abilities are they associated with this kit product offering?
Well, with the CVC bundle kit in particular, we have the ability to customize the tray to a particular customer's needs. So we can pull in any type of device that they would like in terms of the cap for their catheters, the dressing they would like, a particular drape with fenestrations in it. So the kit offers multiple adjustable characteristics that customers would find helpful, I believe.
Now, how else is Centurion innovating in the vascular access space?
Well, we recently introduced our Compass line of physiological pressure monitors. These are small handheld devices that can attach to the end of a CVC before insertion, so at the insertion point, or after the insertion to measure central venous pressure. The vascular access compass also eliminates the arduous setup of a pressure bag and transducer tubing and the need for a monitor in emergent circumstances when you want to get a central venous pressure. It also helps eliminate a deadly problem, which is inadvertent arterial puncture. With the use of ultrasound, we can certainly see if we are near a vein or an artery when we're inserting a catheter. But the minute we put that ultrasound device down to continue our procedure, we technically go blind. And so it's at that point that we could potentially puncture a nearby artery. This happens to the tune of about 60,000 patients a year. And so if we can eliminate that complication by using a device like the compass, it makes it well worth being part of your central venous access procedure.
Excellent. Well, if people want to find out more about the Centurion product line in the vascular access space, where should they go online?
So there's three distinct places. One is they can go to centurionmp.com. They can also, for our dressing line, go directly to sorbaviewshield.com, which offers full description of the securement dressings that we offer, as well as instructional videos. And for the compass, I would encourage them to also go back to the centurionmp.com space. And for the CVC bundle kit, we have a special site called cvcbundle.com.
Okay, and we'll put those on the screen so people can see those. Thanks again. We've been speaking with Eddie Korycka, who is Centurion Medical Products Clinical Education Director. Eddie, thank you for joining us.
Thank you. Appreciate it, Dave.
I'm Dave Gardy here from AVA TV Studios surrounding the AVA 29th Scientific Meeting. Thanks for joining us.